I think now we're switching gear a bit, and what's going to be, I think, a bit of the focus of this panel is to have everyone understand that you guys are operating in 3 total different markets. So that sits in Vietnam, and so we will kind of dive into a bit of the ecosystem of Vietnam. Stefan sits in Switzerland and also operates in Germany, so we'll have a bit of the European flavor here about the health tech ecosystem that he's operating in. And Aakash is in India, so not a small ecosystem as well. And so it'll be very interesting to have your perspective on a lot of things. And so without any further ado, we will start. I will just remind everyone that if you have any question, please ask them in a Q&A section. It's a little easier for me to be able to see what we can ask in terms of question, or else I have to also go in the chat and see what people are posting. So I'm trying to do my best, but just as a reminder, it's a little easier for me. Okay, guys, so listen, without any further ado, let's say I'll start with a bit of the same format as the previous panel. I'll go one after the other. So I guess I'll start with you, Beth, and then I will follow with Stefan and then Aakash, right? So Beth, operating in Vietnam, like I said, can you give us like a quick introduction about yourself, about your solution, and what are the pain points that you are solving?
Sure. Thanks for having me, Helen. So hi, everyone. I'm Beth Ann Lopez. I'm co-founder and CEO of Docosan. So I'm based in Ho Chi Minh City, Vietnam. And we're in the middle of the most intense lockdown that we've had in the country so far. So it's even difficult to get like shippers and things, and people have been staying in their homes for a little over 2 months now. So we've transitioned to fully work from home, and it's also had a decent impact on our business as well. So Docosan is a health tech platform, is a healthcare marketplace. So we help people book appointments, discover doctors, get online or offline consultations. But we also have had a big expansion in our telemedicine vertical. And so more and more people are undergoing consultations online. And we also facilitate the delivery of home test kits through the mail that patients can complete at home, send to a laboratory, and then get the results straight through their cell phones. And so that's a bit about Docosan.
Very good. Thank you so much. Stefan, over to you.
Sure. Yeah. Thanks as well, Helen, for giving me the opportunity here. I'm very happy to be here. So my name is Stefan Gart. I'm one of the co-founders of DoryHealth. And yeah, as Helen mentioned, I'm sitting here in Switzerland, more precisely in Zurich, and we are operating here in Switzerland and also in Germany. So maybe a few words about me. I have a background in biochemistry. I studied here in Switzerland as well at ETH. And after my education, I went into the industry and did some consultancy, strategy and technology consultancy for the pharmaceutical industry. And during that time, we came up with DoryHealth. This was about 2 years ago. And yeah, about 1 year ago, we founded the company. And yeah, since this June, we are on the market.
So what is the pain point you are solving?
Yeah, so we are focusing on chronically ill patients who need to take multiple pills a day. So they have a complex medication schedule, right? So these patients need to constantly renew their prescriptions for all their medication from all those different physicians. They need to buy the medication at the pharmacy, sort their pills, remember to take those pills, or if they've taken it already, and they need to track their symptoms. And all of this while having a normal life, right? They have families at home, they need to work. So this is a lot to take care of, and half of them fail to do this correctly. So they are either missing out the pills to take or run out of medication. And so what we are doing with DoryHealth is we provide them an basically all-round carefree solution that completely takes care of most of these inconvenient tasks. And how do we do this? Our solution consists of a health app that reminds the patient when it's time for the medication and allows them to track their symptoms. We have a smart pillbox that tracks the intake behavior of those patients and provides them with feedback. And they can also share that data with their physicians, for example, caregivers or family members. And third part is our medication delivery service. So we deliver the medication in a pre-sorted way, so sorted by intake time point directly to the patient's doorstep on a regular basis. So these three parts kind of make up our product, which is called DoryGo. And we also want to provide the intake behavior and symptom tracking data directly to the physicians to improve the patient-physician communication, right? So to enable a more data-driven treatment. So that's
very good. Okay, thank you so much. That's very clear. We will certainly dive into a few of these things during the panel. Thank you so much. Aakash, over to you. I'd like to have maybe like a quick introduction. Tell us about you, your solution, and the pain points that you are solving.
Thanks for having me here, Helen. Can you hear me okay?
Yeah, it's a little, to try a bit. Just
I'll try and speak up a little bit. Is that better? Okay, all right,
it
great.
seems to be okay.
Well, it's wonderful to be on this panel. Just a quick background. I'm Dr. Aakash Ganju. I trained as a physician. I worked in the global pharmaceutical industry for about 12 years. And then I worked at the intersection of public health and technology for about 10 years. We founded Saathealth about 2 years back, but really the raison d'etre for setting up Saathealth is based on the work that we've done over the last 10 years. As we've seen most of healthcare beginning to shift away from clinics and facilities into communities. And we think that's the future. That's where healthcare needs to be delivered. And we've seen healthcare organizations around the world and across the spectrum, from public health organizations to the pharmaceutical industry to digital health startups, increasingly look at getting to patients and health consumers where they are, which is in the community. However, the pain point that we've identified is that many of these solutions still don't personalize the experience for patients as much as they could or as much as they should. So how can we help these organizations reach their health consumers and patients with personalized tools in order to allow them to deepen the engagement with health consumers and drive them towards positive outcomes? So Saathealth is building AI-powered tools that we deploy in partnership with these organizations in order to allow them to deepen their engagement with health consumers and drive them towards positive health outcomes.
Very good. Thank you so much, Aakash. All right, let's dive in. So I'll pretty much ask the same question for the three of you as the following question, but wanting to understand more about each ecosystem, I guess. But Beth, if we start with you, what is the biggest bottleneck in the healthcare provider and system that you have seen, to adopt new technology, right? Specifically in Vietnam. So what have you seen that seems to be really quite a challenge for the providers and the systems operator?
Yeah, so I think like things can move a bit slowly here, and there's risk in adopting new systems, right? And I think that risk is even more amplified when you're working in healthcare, in which a provider might already have an electronic health or medical record that has, tens of thousands or even millions of patients' data already stored inside of it. And so the barriers to adopting a new system are pretty high, because how do you move that data from one place to another? Not only that, but you can get used to the system that you have, and unless this new system that you're proposing has substantial more benefits, there's, I think, just a general lack of kind of wanting to try something new, untested. But I think with COVID, and I think it's been something that's like really changed the behavior of not only patients, but of providers here in Vietnam. It's shown them that there is a very strong need to go cloud-based and to go online. So people now, sometimes they're even shifting large hospital systems from old kind of like, Linux-based electronic medical systems to new things that are helping them to connect with patients, do online consultations, and change the overall delivery method that they're using care. So I think it's just kind of, taking the plunge. And a little bit of that is just forced because we have to now, because of the epidemic. You can't always go out to your consultation to see your patient.
Yeah, because I mean, I think that if we all been to Vietnam or know a bit about the space, it's quite also like a dynamic space. And so they are using technology for a lot of things, and we all know it. So it's probably that shift into using technology for actually your own health, right? Or even the provider to say, okay, I'm changing from the traditional means and I'm moving forward. So is that something that you've seen that has changed? Do you think it's because of the COVID that kind of helped to accelerate a few things, or it's still there's still more to do, basically?
I think that COVID definitely accelerated things. So even at our own company, prior to the big lockdowns that were happening in Vietnam, most of our bookings were still for offline visits, where the patient would just book the appointment online, but then they'd still show up and see the doctor in the traditional method. However, now like transportation is limited. You have to go through all sorts of like checkpoints and stuff to even get to a medical appointment here. And so we've just seen a skyrocket in the number of telemedicine consultations and remote monitoring that is starting to happen, even of these different types of test kits. So like, for example, we started offering a COVID-19 home test kit that patients can complete at their homes, and they can hop on a telemedicine consultation with a physician to make sure that they took their sample correctly, they got the right result, and getting the documentation sent to their phone. And so they can use that paper now to get to work, to get through those checkpoints, to show that they had a negative result. And so I think it was more so a matter of necessity than really even just wanting to try something new.
Yeah. So again, goes to say it took a global pandemic to shake things a bit and adopt new technology. That's very, very interesting. Thank you so much for sharing, Beth. Stefan, I guess same question, right? What is the biggest bottleneck that you have seen in getting healthcare providers and systems to adopt your technology, or it could be technology in general, and specifically for Switzerland, right, and Germany, European markets, that also for me seems very still traditional, but yet again, you would think that it would be easier. I don't know. Tell us about that.
Yeah. So I think the biggest bottleneck, I want to separate here between the providers and the healthcare system in general. On the healthcare system part, I think it's most certainly the regulations, right? Everything is highly regulated in these countries. Switzerland is quite known for that, so that they have strong regulations in Germany as well. So this is, I think, the biggest bottleneck in general for new companies or new tech to actually enter those markets, because you need to comply to all of these regulations and to show this and that, right? For like, are you actually bringing some benefits with your new technology? Is it safe? And all of this you need to illustrate in user tests and studies, so which takes a lot of time. And so this is, I think, the biggest bottleneck in terms of the healthcare system. On the healthcare provider side, though, it's most probably the adoption rate of new technology. I mean, in Germany and in Switzerland, we still have physicians who use fax. Do you remember fax? Like the sound of fax? I mean, it's so old, but they're still using that because they're kind of used to that. And yeah, I mean, back in the days, it was probably new tech. So, but this shows, right, that's a whole nother issue. Even though you have new technology like emails and electronic signatures to send over prescriptions on a digital way, they're not doing that because they're not used to it, and because the regulations took so long, most probably. So that is why they're still signing it and sending it per original and faxing it over to their pharmacies. So those are, I think, the two big bottlenecks, which makes slow things down.
Very good. I'm laughing a bit because I'm just all of a sudden I had this image of the young graduate, the millennial, who's like, what's a fax machine? How does that work? Doesn't even know how does that work. That's very, very interesting. And you bring a good point in terms of regulation, because it's fascinating to see that a lack of, or very clear too much of, it's kind of the same problem, because you guys what you can or cannot do, and you have to navigate with that or deal with that. And at the same time, like a lot of startups in, Southeast Asia, for example, is the best example. The lack of makes a lot of uncertainty. So you just dive in and you see if it's okay. You just wait and see, right? So very interesting to see that you almost have the same problem, basically. And it's all about regulations. Very interesting.
Yeah.
Thank you so much.
Definitely.
Very good. Aakash, over to you. I think that, a really same question, because I'm just trying to understand a bit or give a flavor about the ecosystem, right? What is the biggest bottleneck in getting healthcare providers and systems to adopt new technologies in India?
So, Helen, when I was on the physician and the healthcare provider side and used to hang out with my tech friends, we were really seduced by what tech could do. And the conversation was pretty much along the lines of, can we just get these doctors and nurses out of the way and we can transform the healthcare ecosystem? Just give it to us techies and we'll change the world, right? And then when I started hanging out with the tech guys a lot more, I realized I kept telling them, you can't do that. You don't understand why the doctor's doing this. So it's really very complex, and we would love for Steve Jobs to come and just transform the healthcare experience. It doesn't work quite like that, and that's primarily because healthcare is a very, very complex ecosystem. And let me just give you an example. If you or me or any of us walks into a hospital, right, and just draw a map of all the stakeholders around there, the physician, the nurse, the CFO of the hospital, the CEO of the hospital, the insurer, the pharmaceutical company, the diagnostics company, all of them want you to get healthier. Of course, that's a given. But all of them have different incentives on a day-to-day basis, right? So I think one of the biggest bottlenecks to adoption is that very often innovations are designed in very closed, siloed environments, and they don't really think through what's the value proposition of this for every stakeholder around the table. That is the biggest bottleneck. I've become a little less cavalier in blaming doctors for being Luddites and not adopting technology. I've begun to appreciate a little bit more that I need to give them a value proposition if I really want them to change their behavior. And I think some of the new age companies that are really thinking through the UI UX for everybody, not just the patients, are beginning to crack that. But it's still a high bar. So that's one. On the consumer side, I think one of the biggest bottlenecks for adoption is that I think there's some incredibly exciting work happening on the front end with companies transforming the UI, UX, and the patient experiences. But many organizations still tend to look upon patients and health consumers as recipients of healthcare. Just think of health content that's put out by most companies, most governments. It's boring, it's paternalistic, it talks down to you, it doesn't engage you, it doesn't excite you, it doesn't make it aspirational, right? So as a health consumer, one of the biggest problems with adoption, I think, is that, of course, if you have cancer, you can't tell an aspirational story to a cancer patient. I get that. But for many other indications, can you try and make it a more enjoyable experience for the patient? I think it's a responsibility that we have to take upon ourselves if we want to lower the bar for adoption by health consumers. So it's complex, but I think we made tremendous strides in the last 20 years, and particularly COVID has really amplified and accelerated our journey towards adoption.
Yeah, I think that we don't talk enough about all these silos in healthcare, and that is truly, you are so right. The lack of communication between all these silos, right? It makes it really hard to navigate around and have them adopt a certain technology across all of these different verticals within healthcare. That's very interesting. Thank you so much. It's true. We have to bring this light, this thing to light, basically. Beth, if we go back on what you were saying earlier, I mean, we talk about some of the bottlenecks, right, for health providers in the system, but let's talk a bit about the consumer side, right? Because again, like I was saying, like, I guess for me or for a lot of people, we tend to believe, or at least think that Vietnam is quite savvy, especially, I guess, the young generation, of course. But I mean, is there still some challenge in having, patient adopting new technology? And if it wasn't for COVID, I mean, what do you think? Where do you think the situation would be at this stage in adopting new technology, specifically more like Docosan?
Yeah, I think patient education and adoption is still on a long journey here. Even though Vietnamese are really tech savvy, everyone has a cell phone, you have great internet access throughout the country, even in the countryside, like it's amazing. I've been to some pretty remote places and had like better 4G than I did in like in the US when I was there.
Or Switzerland.
But yeah, like and people are using it every single day too. Like so in the middle of the COVID outbreak, we have the local version of WhatsApp. It's called like Zalo, and they use it for everything, for organizing like food delivery, for finding out, getting updates from the government, from hearing from your local police force, and all these kind of things. But healthcare is somehow still seen as something a little bit separate. It's something a little bit different. You might feel comfortable ordering, food from a local restaurant, and you don't necessarily have to see what is being done at that restaurant to trust that the food is safe and going to come to you on time. But healthcare, there's a big leap between like buying, some sort of consumer good to potentially putting your life in the hands of someone else that you may not be seeing on the other side. So people are very they're cautious. Like already just in accessing private healthcare here, there's huge variations in quality and price, and these sometimes things like this happen. And so I think it's like a little bit of a lack of trust sometimes, and so they're kind of waiting for a really trusted platform where you can know that all the doctors on the platform are real, and you're actually, if you pay money for something, you'll get it, because still most people are using cash on delivery for things, because like you never are entirely sure if the order is going to come through, right? And so I think like a bit of a lack of trust is one of the barriers. And then beyond that too, it's like there's a lot of new behaviors and things that can go with healthcare. So for example, with Docosan, the main vertical that we have is healthcare bookings. And so in Vietnam, like a lot of other Southeast Asian countries, making a booking for a healthcare appointment is kind of a new behavior. Right? You can see that there's tons of advantages to booking something in advance. You go, you don't have to wait in line, that the doctor's gonna, be there when they say they are, but still people are used to getting up early, showing up at the hospital, and you wait in line. And that's just like what people have always done. And so then, you have this other paradigm, and it's kind of like, how does that work? And so kind of like explaining the benefits of that. And then once people do it a couple of times, then, they're hooked. You don't want to wait. You don't want to, especially in like a COVID kind of situation, but it's something new. And maybe it's something, you take that health seeking behavior for granted when you come from a place where, things are a little bit more orderly sometimes. And then I think the other thing too, in delivering our test kits, is even just like the faith in the patient being able to collect samples for themselves. So there was a lot of concern in Vietnam about whether patients could self-sample themselves for the COVID tests. So you have nasal swabs. It's really not hard, right? Like, I mean, you take the swab, 2 centimeters inside of your nose. It feels funny, but then you put the buffer in, and you get your results in 15 minutes. But even that, there was kind of like debate, like, can people do that? Do they know how to follow instructions? Let alone if you're talking about a different type of test kit, when you're like drawing blood, for example, using a lancet, people are like, it can be a bit of a shock because it's so new. However, they've been doing this for over a decade in the US and Singapore, home test kits, home sample collection. And so, I think like, it's one of those things that you think about, like Airbnb way back in the day, and it's like, oh my God, would you really let just strangers like stay in your house? That sounds absolutely absurd. But these kind of things are going to come to emerging markets too. And I think it's going to happen in healthcare, that we have an entirely new delivery model that like empowers the patient to, take their own samples, like to take control of their health, making, the appointments and having everything in the same place. It's a matter of time, but there's definitely a bit of a road ahead in terms of like patient education and adoption.
Yeah, very good. And I think that it's true that when you deal with the first part that you were saying about trust, this is a tough one to crack, because I mean, you can't build trust just like that, right? There has to be some fundamental things that are put in place in order to have people really believing that, this is safe, this I can use, this I can do. And so that is very interesting. I didn't know that part about the ecosystem in Vietnam, so that's very interesting. Thank you so much for sharing. I guess, Stefan, on your side, trust is probably not a concern in Switzerland for sure. But can you tell me about, I guess, maybe let's dive in on your side about more about the approach that you have taken in order to empower patients and clinician with your solution.
Sure. So we're primarily focusing on the patients here. We're not really empowering clinicians, but our approach to empower patients is via their data, right? So we collect during, like with our product, a lot of very sensitive and relevant data to patients, such as it's called medical data, like lab results or the conditions they have and what medication they're taking, right? We know how the patients are taking their medication. Are they doing that consistently on a regular basis? And what time points and what time differences, and how well is the treatment going, right? That's the third part of data we're collecting. Is are the symptoms being steady or increasing, declining? How are other results, right? Like the outcome of the treatment. And those three data points are very, very relevant for the patients. And with that, they have an impact on the treatment itself, because by sharing that data with their physicians, they can kind of bring the physicians to believe them, right? Look, I tracked my symptoms over time, and you see it's not going well. Please change something, right? And in some cases, this is very important, so that the patient kind of can integrate within their own treatment by providing that data. In some cases, it's not only that the physicians are not believing the patients, right? But also by showing them that they're taking the medication, which is something the physicians usually just don't know. They have an impact, and they can say, look, I'm actually doing what you're saying, but it's not working. It gives a lot of how do you say that? It has a much bigger impact on the physicians in that way, in that sense, right? If you can show all of this data. So this is and it's not only on an impact on the treatment itself, but also on the pharma companies as well, if I'm thinking about it. Like by showing these kind of data, you can do large real world evidence studies, right? And analyzing the drugs themselves. Are they efficient? Are they efficient under real world circumstances? Are they safe, or are they more problematic than expected? And all of this comes because the patient is willing to share their data.
That is so true. It brings me back a bit to just a few years ago, or even still happening now, right? People are taking medication, they go to their doctor and they say, yeah, I've been taking them, but that's it. You have nothing else to rely on to be able to help the clinician or the doctor to really say, but now that you have data, then you can actually see the certain patterns, and actually you probably have also some indicators as well to help them find the best medicine or readjust things, I imagine, right?
Exactly. Yeah, definitely. I mean, the patients often don't realize how important stuff like this is, and they're not willing to share their data, but it can have a lot of benefits for them in that sense. If they're willing to share that data with their physicians, it can individualize their treatments, right? Because the patients can react on that. If they see, look, in other cases it went well, but in your case it doesn't seem like, so let's switch that up. And this is something that the patients do have that power, but currently they're just not using it. So this is something we want to change.
Okay, very, very interesting. Thank you so much, Stefan. Aakash, when we look at the way that patient wants to participate now in the decision-making process, right? We see this more and more, but it comes with a lot of challenge, both from the patient side and from the doctor side or clinician side, right? Can you tell us how you are building your solution to try and overcome some of these challenges?
Yeah, so I think we are building a solution to adapt to the complexity of the ecosystem. And I talked about this in the previous question. And let me give you an example. I mean, our platform is indication agnostic. We are also working with partners across different sectors, so public health, pharma, insurance, digital health, and also across different geographies, so even outside of India. And the kind of power that you want to put in the hands of a patient is very different depending on the indication. Let me give you an example. If you're building a solution for children's health, which is largely preventive, you can go straight to the end consumer, which is the patient or the parent, and you can empower them with everything that you want to give to them, right? But if you're building a solution for a patient of cancer who's undergoing chemotherapy, you can go directly to the patient. But we think there's a lot of merit in making sure that what you're giving to the patient is channeled through the physician, because this patient is going to need the trusted hand of this patient. So given all of these different complexities and permutations and combinations, our solution is to build a very modular platform. So we can do the entire soup to nuts. Our platform is an aggregate of multiple modules. We have a behavior change content module, a notification module, a real world insights module, a personalization module, a gamification module, and an AI module. And depending on the indication, the partner, and also it depends on the maturity of the partner, the maturity of the geography that we are working in, right? So given all of these combinations, our partners could choose to use one or multiple modules to put together a solution that works for their context. So this is one of the ways in which we're addressing the challenge around our adaptability, because it's important for us to make sure that our solutions work for the patients and the providers at the end of the who are receiving this. The other thing that we are beginning to do is we are very fascinated by the concept of digital churn. And as you know, digital healthcare users don't stick to their applications the way they do on e-commerce or social media or gaming or whatever, right? So we've been analyzing why this is, and based on the research we've done, we've identified 6 different digital phenotypes of users, right? I mean, they just engage with digital applications very differently. On one end of the spectrum, you'll have digital users who will consume the content prolifically. They will share with their family. They will stay on for a long time. The other end of the spectrum is a huge chunk of people who will barely engage, right? And we found 4 phenotypes in between those 2 extremes. And I think what we are beginning to do is offer the opportunity to our partners to tailor experiences based on digital phenotypes. The first and the 6th, they require their different profiles. They interact differently with digital applications, and hence they must receive more tailored, more customized experiences. So this is one of the ways in which we are demonstrating that, hey, you have a way and the tools to now keep your patients engaged with you longer, and you have a better shot at giving them the efficacy that we're targeting for them. So these are some of the ways in which we're trying to overcome the challenges around adoption.
Yeah, I think that's what we were mentioning a bit earlier, right? The thing is that healthcare is not e-commerce, but at the same time is way much more important than your little shopping online. So how do you build tools to really make sure that people are sticking with the solution that you guys are bringing out there, right? Yeah, very interesting. Thank you so much. I'll just remind everyone, our attendees, that they can ask questions in the Q&A section. We already have one that just arrived, and so please you can send a few more. We will have the time to go through them, and it's actually always a fun part, because then we improvise and we are able to really bring some insights to you that is more tailored for what you want to hear, for your needs or questions. Going back to Beth, so curious to hear what are the latest trends that you have been seeing in healthcare technology. It could be kind of like general, global, or it could be more pinpoint towards Vietnam. But I'd be curious to hear what are the latest trends that you are seeing.
Sure. Well, within Vietnam, I'm seeing the trend of people starting to go towards a brick and click business model, in which you have companies that were previously all software that are now starting to build their own clinics. And I think a large part of that is like wanting to control, like the quality of the healthcare services that you have, maybe having like telemedicine consultation on demand. But yeah, I think like for us, we have not gone down that pathway. I think there's a lot of like strength in staying like pure software, in addition to having some kind of direct to consumer test kits that we sell. there are already 50,000 private clinics in the country. And I think like, while we're good at tech and we take advantage of the fantastic software developers here and all of this, we would rather not compete with our customers at the same time. And so we found that we've been able to add value to them by helping them to expand their own businesses, by attracting new clientele and sending new business to them too, through the teleconsultations and other forms. And so, it's definitely been a trend that I'm seeing more of in Vietnam, though it's not one that we're following ourselves.
Do you believe that some of these guys that are building it's almost an integrated vertical, right? Do you believe they do it just simply to make sure that they have, I guess, a solution for the entire supply chain, and that makes sense for them? Or do you believe this is in response to maybe some of the users actually asking if I can, on top of it, go directly to the clinic where the software is attaching to, I'd feel more comfortable, or I would trust it more, again, because of this kind of Vietnam, particularity that we have?
Right. Well, I think it has to do with controlling, every step of the supply chain, right? Like you can make sure that, you have the right medicines, you have everything in stock, they're using the same system, because like one of the major challenges is just adoption and getting, existing players to adopt new technologies. And so that is something that is wickedly difficult. You not only have to show that what you're doing can bring them a lot of value, but like, why they should switch from their existing behaviors and practices to try something that a startup came up with in the last, couple of years. And so for us, like I can definitely see like why you would want to have like that level of control throughout the supply chain. But I also think that there's a lot of value in being a big connector. And like we can be the ones that are connecting, thousands of clinics together, as opposed to, having a small group of, solid, kind of clinics. I think it also gives us the ability to have more specialty care. Because like certain specialties, there's just a limited supply of them, right? Like if you're looking for a neurosurgeon, there's only, so many in the country. But if you're trying to only you have to hire every single, like a neurosurgeon, you have to hire a psychologist, psychiatrist, and some of these kind of specialty areas that are so difficult to recruit for, retain, let alone kind of like manage their schedule. I think it kind of comes back to the original problem, in which, I also think like healthcare providers too, in Vietnam and a lot of other countries in Southeast Asia, a lot of them are business owners themselves. Like they like having their own clinics. They went and got this like fantastic, medical school education. They like serving patients, but it can be quite difficult. Like the salaries are too low in some types of like hospitals, and so like why not work for yourself? And they're smart people and they want to do that. And so like for us, it's more of like giving the clinics and hospitals the tools to succeed and utilize their own educations to focus on what's important to them, which is treating patients, and not having to worry about like, the marketing, not having to worry about, like where do they find the labs, where do they find, whatever else that their patients need.
Very good. Thank you so much for sharing that. That's very insightful. Thank you so much. Stefan, if we go back to what you were saying a bit earlier about how, the approach that you are taking to really empower patient, I'm sure that you've encountered a lot of challenges along the way. I'd like to hear some of those and how do you go about them? Because I mean, again, this is about making sure that the patient is using the technology, but as well as that they will want to continue using it, right? And so, I'd like to kind of hear a bit about your experience trying to do this.
Yeah. So as I mentioned, like what we want to achieve is empower those patients, right? By giving them their data in their hands to make things happen. And the challenge we had was kind of to create a product that the patients want to use, right? And when we looked at the competitors, this seemed kind of difficult, right? There are some other competitive solutions out there, but not many of them are actually used quite a lot. So the question was, why? Like, how do we change that? How do we create a product that actually the patient wants to use? And what we realized is that most of these competitive solutions are focusing on the intake behavior, like the adherence, because those has like when you improve the intake behavior of those patients, you have the biggest cost benefits for health insurances, for example, and therefore you can achieve a B2B revenue stream, right? You have someone who will pay for your solution, and that's why most of these companies focus on improving that. The problem, though, is that the patients themselves, if you ask them, they don't see that as a problem. If they have the perception that they actually are taking the medication correctly. So if this is the case, you cannot create a product that is solving their intake behavior, because it's not solving their problem. Even though they have that problem, if they don't perceive it as their problem, they won't take your product. So what we did instead is we created this convenience approach, right? We created a product that is primarily focusing on increasing the convenience of the patients and making things simpler. And this was the biggest challenge. How do you make it convenient? And the only way to actually achieve this is through integration, right? Embracing the complexity and tackling it yourself. And yeah, so this was kind of our approach. Make it as convenient as possible, and to integrate it with physicians to give them the benefits of sharing the data.
Yes, I think that once people experience simplicity and a seamless care, I'm sure they will go back, right? I would be the first one for sure, but it's true that it's probably not easy to implement, though, making sure that it's actually more convenient and not the opposite, right? Because as a builder of a solution, it's probably very easy to get entangled in some of of the system that you have to go through, right?
Exactly. I mean, if you just take a simple example from a reminder app, which you can use to set up your reminders for the medication. I mean, it's kind of solving the problem that patients forget their medication, but it's not convenient at all. The patients need to set up the medication themselves, adjust the schedules, and if something changes, they need to do this themselves, right? It's just a reminder, at least. So it has an alarm function, but it's not really solving a problem. They still forget their medication, even though they have that. So this is kind of you need to reduce the complexity for those patients in order to have an impact and improve the patient's behavior as a side effect, right? Not increasing the complexity.
Indeed, this is fascinating. Thank you so much for sharing. Yes, listen, let's move gear a little bit in the sense that I'd like to ask Aakash a bit, I guess, a general kind of question, because I think it's interesting to understand how is India actually evolving, right, when it comes to digital health adoption, and what is the response that you have seen in your ecosystem. And I guess it'd be interesting, or even our participant, interesting to know also what about COVID must have had helped on a few front, right?
Yeah, I think it's a great question. So like many low and middle income countries that don't have the physical infrastructure to cater to healthcare needs, I think India has the opportunity to really leapfrog on the back of digital infrastructure. I think that's often been said, but it's really very true. And what's happened in the last 18 months due to COVID has been terrible because of the loss of life, but in many ways, it's actually created a huge opportunity for us to leapfrog forward. And I like to think of the last 18 months as the biggest behavior change experiment in the history of healthcare, right? Because now there are literally billions of people, health consumers all over the world, sitting in the drawing room and talking about genome sequencing and immune response and vaccine structure and virus structure over cups of tea and coffee. This never happened before. And they're going and having these conversations with their physicians and their doctors. And there's a lot of bad information out there. I get it, but on the whole, I think it's a very, very positive development. We can expect that this is going to further accelerate patient behavior and get them to start playing a more active role in their own healthcare. On the physician side, I think there's been a tremendous shift. Again, in India, I was recently part of a seminar where we looked at the shifts in practices and adoption of virtual medicine on part of physicians. dramatic shift, as you can imagine, a lot of things happening. I still think on the physician side, we are largely digitizing existing ways of doing business. So we haven't really seen transformational leaps in how to build care pathways that are digital first. But I think that's coming. So in general, the government's very focused on the digital backbone, working on a unified health interface. In general, I'm very, very optimistic that there's huge opportunity for us to leapfrog using digital infrastructure. We've seen tremendous response. And look, like I said earlier, our platform is indication agnostic, right? So our children's health platform was with over 200,000 users across India, got tremendous response. We're just launching a family health app to educate people across India around COVID and adjacent conditions related to COVID. We just won the innovation prize from the George Institute of Public Health. We're launching a chronic disease app. We're working with partners to launch our platform across therapeutic areas as diverse as oncology, cardiology, maternal and child health, targeting healthcare workers, health consumers. So I think the conversation's really been accelerated. There is definitely an appetite. Everybody in every boardroom is asking, what's our digital health strategy? What are we going to do? And more importantly, I think there has been euphoria about digital health in the past. And I think, Helen, maybe you and I talked about this earlier. I think this time they're asking, how do we measure success, right? We've done digital health investments in the past, and we don't know, the jury is still out on whether it worked or not. But this time they're saying, how do we make sure that this time we can measure the outcomes and measure the success that these digital health investments are bringing us? And I think that's helping filter out people and organizations that are really serious and committed to digital health versus those that are just building a nice app and putting it out in the lab. So I think this is a really big opportunity. And we should really keep our finger on the pulse. And we are very excited to be part of this transformation, and hopefully we'll play at least a small part in it.
Yeah, you bring a good point, because I think this is often some of the conversation I have as well. People are asking me, how do you measure the return on investment of digital health? And it's actually very hard. There's definitely a few metrics that you can use, but in the end, this is something we all need to work harder on to make sure that we are capable of proving that it actually works and that it's worth everyone's time and money as well, to really adopt this new technology for the entire ecosystem. Definitely interesting, guys. Thank you so much for sharing. I will dive into maybe just this one question, because we're going to have to move to the next panel. It goes so fast. There is Aditi who's asking, are these cultural barriers to digital health in the various geography that this panel covers? Are there cultural barriers, to digital health in all of your different geography? Maybe a little hard to answer. Is there someone that would like to start?
Go ahead.
Okay, well, I guess in terms of cultural barriers, two of the top specialties that are often booked on Docosan are in sexual and reproductive health and then mental health. And so these are two areas of healthcare that are highly stigmatized and really difficult to talk about. And so while I think there's not a barrier to digital adoption of these, but this existing barrier to seeking treatment makes people go online more, because a lot of the times people just talk to a family member or a friend about where should I go to get X, Y, and Z procedure, a good pediatrician, but you're not going to talk about this if you think you have an STD, for example. You're not talking about this openly, but you'll look on the internet and you want to find guidance and you want to find where to go, where can you go that they're not going to judge you. Same thing for mental health. And it can also be scary too, depending on what kind of symptoms and things you're going through. You can't talk to anyone, but a lot of what we try to do is write friendly articles and things that work on destigmatizing it and linking them to providers who won't judge them for having whatever issue that they have.
Very interesting. Thank you so much for sharing. Yeah, indeed, makes sense completely. Now, sometimes technology can also, I guess, help elevate some of these. It's not a cultural barrier, but it's some cultural topics, I guess, that technology can definitely help on those. That's very interesting. I don't know. Would you have anything you'd like to opine on? I guess Stefan, on your side, in Switzerland, Germany, what you are seeing.
Sure. I mean, it's difficult to say a cultural barrier
Yeah.
here in Germany and Switzerland. It's the one thing we noticed though is that most people actually don't know how many medications other people are taking, right? So they're not openly saying that and telling other people's or friends about their medication intake. That's something you kind of keep secretly. And what we are now trying to do is to make a mobile version of it, right? So
Yeah.
our smart pill box is kind of fancy looking, right? It's more we kind of do a lifestyle product out of it, so they don't need to be ashamed of it and have all their medication packages somewhere buried in their handbags. And it's not that they need to show this off that they need to take medications, of course, but we try to kind of reduce that barrier that they need to take medications, because a lot of people actually do. And but this is something we noticed as a culture barrier, that the patients just don't want to share that information, right?
Indeed, actually, you bring this to, I guess, my attention and everyone's attention. It's true. It's not something you would have thought of for, you know, Europe, but it makes sense. Makes total sense, actually. Thank you so much. And you, Aakash, can you opine on this?
Oh, sure. I think this is a great question. There's always cultural barriers, and within India, every 100 kilometers, we have different dialects. So, you know, there's huge cultural barriers even in one country. I think the cultural barriers can be addressed through good, hard ethnographic research. You know, you adapt your solution based on ethnographic research. So I think that's easily taken care of. What I think we should really focus on is not the differences, but what's common, you know, to patients and health consumers across the world. And I'll tell you what's common. Everybody wants to be not talked down upon. All patients anywhere in the world want more information. They want the agency, and they want choice. They don't want the feeling that going to the doctor's clinic is like going to a death sentence. I think that's pretty common, right? And the healthcare experience bar is generally set so low that if we just start treating patients like equal participants, giving them information, making them feel that, hey, this doesn't have to be a terrible experience for you, I think we can really circumvent a lot of those cultural barriers. So let's focus on what the experience should be like for all of us when we go to hospitals as patients and as consumers. And I think we'll work out the barriers bit.
Thank you so much for sharing. Very interesting. Yeah, all the dialects in big countries like India, or I'm thinking about my experience when I was in China. It's quite impressive. Indeed, thank you so much. Listen, guys, it's all the time we had. Sorry, I'm seeing some more question in Q&A, but unfortunately, we have to move on. It was extremely insightful and interesting to be talking to all of you, and also to understand a bit more about your ecosystem as well, so which is fantastic. We've won on both learning about your solution and the ecosystem. So thank you so much again. And I guess if anyone wants to connect with you, they can simply connect with you via your LinkedIn. If ever you have a minute and want to share your contact details in the chat, that would be fantastic. So thank you again, everyone, so much.
Thanks so much, Helen.
Thank you so much for having us.
Thanks, Helen. Thanks, everyone.